Welcome back. In this video, we'll look at the guidelines to treat menopause symptoms. The main symptoms are vasomotor symptoms, and these include night sweats, hot flashes, vaginal atrophy, and moodiness. If the symptoms are mild and non-disruptive to the patient's lifestyle, the treatment is lifestyle and behavioral modification. This includes wearing clothes made of natural fibers and not synthetic fibers, staying in a cool environment, especially at night, drinking cool liquids, such as iced water or iced tea, avoiding symptoms triggers like spicy food, smoking, or alcohol, relaxation techniques like cognitive behavioral therapy or yoga, and some studies mention the benefits of acupuncture. If the symptoms are more severe or moderate, the patient has to replace estrogen, and for this, we look for estrogen contraindications. If the patient has breast cancer, coronary heart disease, endometrial cancer, or liver disease, we avoid hormonal therapy with estrogen and treat them with SSRIs, like fluoxetine. If they don't have any of these conditions, we see whether or not they have an intact uterus. If they do, we treat them with both estrogen and progesterone to counteract the effect of endometrial cancer. And if they don't have a uterus, we treat them with estrogen alone. So here is the tree of the full guidelines. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.